I would like to welcome you to our IDK webinar, Hidden Diseases, right from the recording studies of Immundiagnostik Bensheim in Germany. For us, it's very important to have an early and correct diagnosis of celiac disease, because then we can avoid complications and secondary diseases. That improves the general state of health and the quality of life. The content of this webinar is based on actual international and national guidelines. Let's start with our first symptom, anemia. Let us look a little bit back what happens with celiac disease. On the left picture, you see a healthy duodenum with the villi very prominent and visible. If you compare the area of the gut with something you know, then the duodenum has the size of a tennis court. In the case of celiac disease, Marsh 3, the hardest classification, the intestinal surface shrinks about to 1 square meter. That's just a table. Then we have malabsorption of vitamins and minerals, leading to deficiencies. If people stick to their gluten-free diet, you see, even here in this example, after 5 months, better structure of the villi. They are not really comparable to the first picture, but they are visible again. And then you can expect a surface in the duodenum of, let's say, a ping pong table. Anemia is caused by different things. One is that there is an iron deficiency anemia. Iron is not absorbed in the duodenum. That is the case in celiac disease. Or you are pregnant or you are in the lactation, then you consume too much iron. Another factor is that the excretion of iron is enhanced by, for example, a long and heavy menstrual period. Another cause of anemia is a deficiency of vitamin, especially vitamin B12, which is needed for the metabolism of the iron. Here, a poor vitamin B12 deficient diet may lead to this situation. Vegetarians and vegan diet leads to vitamin B12 deficiency too, and excessive consumption of alcohol. Chronic diseases may also cause anemia. That can be chronic infections, intestinal diseases like inflammatory bowel disease, heart failure, liver failure, and massive alcoholism. And there are acute and chronic blood losses due to bleeding in the gastrointestinal tract or an unnoticed blood loss over a long period with hemorrhoids or gastric ulcers, and so on. Finally, there are some other causes like trauma or surgery, bone marrow diseases like leukemia, medications, viral infections, or some very rare congenital diseases like thalassemia or sickle cell disease. So we have 5 causes for anemia, and 3 of them are linked to celiac disease, because here you have too little absorbed iron, you have vitamin B12 deficiency because of malabsorption, and it is a chronic disease.